One thing you can count on during surgery, there will be blood. Surgeons use superabsorbent towels, called sponges, to mop up blood and other fluids. Once they're soaked, the sponges are put in a receptacle. At the end of the procedure, nurses do a manual count of the sponges to make sure they're all accounted for. Only then is the patient finally sewn up and sent to the recovery room. That's the way it's supposed to happen. But every year in the U.S., an estimated 4,000 sponges or other surgical objects are mistakenly left inside patients' bodies. UC San Diego surgeon Tony Perricone says sponges left behind can become a major source of infections.
Because your body's trying to fight it. So it will continually cause an inflammatory condition in the patient, and it will continue to worsen. And worst case scenario, it actually causes a complication where maybe it erodes into an important vital structure.
It happened to Nelson Bailey, a judge in Palm Beach County, Florida. He had 2 intestinal surgeries at Good Samaritan Medical Center in West Palm Beach in 2009. For months afterwards, he was in pain. It kept getting worse. He had numerous x-rays and CAT scans. Finally, doctors identified the problem. The surgeon had left a 12-inch by 12-inch sponge wrapped around Bailey's intestines. Bailey went to another hospital to get it removed.
The surgeon who did the operation there told me when he opened me up, it smelled like a sewage plant. There was infection in there, and I was lucky I hadn't gone to a stage of being fatal.
A company called RF Surgical Systems, which does its research and development in San Diego, makes a product designed to eliminate these kinds of medical errors. It's a surgical sponge that contains a small radio frequency tag. At the end of a surgery, an electronic wand detects whether any sponges have been left inside a patient. CEO Kevin Cousins says it's the brainchild of a surgeon at Cornell University.
He came up with the concept after a long, grueling surgery where, in essence, at the end, there was a miscount. They spent almost an hour trying to rectify the count through an anthill of bloody sponges and gauze. They counted them all. They had to bring it in a portable C-arm, and he just thought there's got to be a better way.
A C-arm is a portable X-ray machine. Patients are X-rayed if the sponge count is off. Cousins says his system is not meant to replace the manual counting of sponges.
What our technology is a extra level of safety. It's an adjunct to counting. The nurses do a great job in counting. This is a way to sort of validate when there is a miscount, when they miscount, as well as when their counts are correct. Because interestingly enough, most times when there's a retained object, it's when the counts are falsely correct.
Indeed, one study reveals 62% of retained surgical objects were found after the count was mistakenly reported as correct. The RF tagging system includes the monitors, wand, and sponges. It costs about $10 per surgery. It sounds like a no-brainer, right? You get the latest technology, it's low cost, and it prevents medical errors. Even so, not all hospitals want to use it. San Diego's Sharp Memorial Hospital performs more than 20,000 surgeries each year. The director of surgical services, Beverly Self, says her hospital is familiar with the radio frequency tag sponges, but she says Sharp has decided to stay with its current system.
This is a lap sponge. This is used mostly in our abdominal areas of our patients. This is X-ray detectable, so that if we have a sponge that's missing, when we actually count at the end of the case, we start at the beginning. These come in 5 counts of 5, so we always count in counts of 5. And at the end of the case, if for any reason we have a sponge that is missing, we will do an X-ray. That is 100%. It tells us if the sponge is in because this is X-ray detectable.
But it's not foolproof. Just ask Judge Bailey. The sponges his hospital used were supposedly X-ray detectable.
The count record that they kept showed that all the sponges that had been placed in me had been removed. One of the problems I had, in addition to everything else, was 2 different radiologists looked at the follow-up X-rays and CAT scans and failed to identify the sponge.
As a result of Bailey's botched case, Good Samaritan Hospital in West Palm Beach switched to the sponges made by RF Surgical Systems. The company says more than 200 hospitals use their sponges, including UC San Diego and Naval Medical Center San Diego in Balboa Park. The average cost to settle a case of an object left inside a patient is around $350,000. Nationwide each year, hospitals and surgeons have to pay out a total of more than $1 billion in claims for these mistakes. Kevin Cousins says don't forget the human toll.
Each one of these statistics have a patient's face on them, issues where they've got to go back in and be reoperated on, maybe losing sections of their intestine, or maybe losing the ability to have children, having to have hysterectomies. There's real consequences to retained objects. Sometimes there isn't, but it hits the whole gamut.